Welcome and thanks very much for joining me. My name's Nicole Hamilton. I'm a physiotherapist with Synergy Physio on the Sunshine Coast of Queensland, Australia. What I'd like to do today is share some tips and advice on how to minimise your back pain and how to adjust your yoga practice to manage this. So in this clip what we're going to be looking at is back pain that occurs with forward bends. Now there can be many reasons for pain with forward bends, which is why it's always best to get individual assessment or advice from a physio or a health practitioner. But the most common reason that I see for back pain with forward bends is excessive stretch through the lumbar segments, ligaments and discs. So let's start by having a look at our anatomy. So you can see here that the lumbar spine stacks up like a building block on top of the pelvis, which is like the foundation for the building. Between each of your lumbar vertebrae you've got a disc. And you can see that in a normal lumbar spine that you have a small arch, which we call a lordosis. And your lumbar lordosis is different sizes with different people depending on your genetics and your habits in your life. So it's because of this lumbar lordosis that's natural and should be there that our lumbar spine has a little bit of a limited capacity to bend in that segment. And in fact, most of the time what should happen when we bend is that we flex more through the hips, which is a nice axis of rotation, great, and then come back up. So generally what should happen in healthy forward bending is the hips do most of the movement and the lumbar spine does just a little bit of the movement. So the most common reason for back pain with forward bends that I see tends to be too much restriction in the hip joints, which means that the hips don't move well enough, resulting in excessive motion or excessive bending in the lumbar spine. So the lower back ligaments and discs really don't like bending excessively, a little bit like your ankle ligaments. They don't like rolling over excessively, and if they do that repeatedly over a period of time, you can get little micro tears or swelling in the area that then needs looking after by a health professional. So to try and modify some of our yoga postures, what we do need to do is to ensure enough hip mobility and to make sure that our lumbar spine isn't flexing excessively when we go into forward bending. So let's have a little look at about how we might do that. So let's first start looking at some preparation postures to try and improve your hip mobility for protecting your lower back with forward bends. Now there are plenty of yoga postures that you can choose from, but the ones I like if you've got a bit of a sore back is actually nice restful supine postures with a strap. So if you start with a strap around your foot, if you keep your opposite leg straight, it will actually encourage that small lumbar lordosis to maintain itself. You can start with a straight hamstring stretch and progress into a half happy baby, so a bent leg stretch, which will again open up the back of the hip. And you can also in this position do like a supine pigeon pose, which will again loosen the buttock areas and encourage and improve your hip mobility so that forward bending becomes a little bit less troublesome on the lower back. So if we start now by looking at how to modify some of your yoga postures, we can start with a basic pyramid pose, which is a forward bend. And to protect the lower back and to maintain a small lumbar lordosis, the first thing that you need to try and do is to create a little anterior pelvic tilt in the pelvis. So the way to do this is if you can imagine your pelvis like a bucket of water. If you tip water out the front of the bucket, that's called anterior tilt. If you tip water out the back of the bucket of the pelvis, that's called posterior pelvic tilt. So before you go into a forward bend, if you create just a very small anterior pelvic tilt, and then you can go forward into your forward bend and still maintain a lumbar lordosis, which is a nicer place for those lumbar discs and lumbar ligaments. So the other thing that you can add, as well as a small anterior pelvic tilt, is as you bend forward, if you can imagine your sitting bones separating and your buttock muscles relaxing, so that way you can fold over the hip crease, which means that your hip joint is more likely to contribute to the movement of forward bending. So forward bending over two legs is actually much harder to control, but the same principles apply in that if you can create a very small anterior pelvic tilt to start with, then as you fold forward, think of your sitting bones getting wider and your buttock muscles relaxing as you go into the fold. You may reach a place where that's far enough and your low back starts to contribute to some movement, and if that's the case, it might be worthwhile just coming back off the stretch, or the other option is to bend the knees very slightly so you can maintain that small lumbar lordosis. So again, in seated forward folds, to protect the low back, what you would like to maintain is a small lordosis. A nice way of doing that is actually just to sit up on a bolster, which lifts the hips up a little bit and means that that pelvic tilt is a little bit easier to access. So tilting a little bit of water out the front of the pelvic bucket before you then fold forward. Using a strap is a nice way to guide you. If you find that you're not able to go too far before getting a flexion through your lumbar spine, the other way of trying to adjust this is to bend the knee very slightly. And again, a double leg forward fold can be harder to maintain good postural alignment through your lower back. So my suggestion with this is to bend the knees generously and to sit up on a bolster, and again encourage a small pelvic tilt forward before allowing yourself to fold forward. So full forward bend postures such as plough pose, if you've got pain with forward bending, are probably best avoided. It is quite loaded. It is a full stretch on the neural system, so if you can imagine your neural system a bit like a tadpole with your brain as the head and the tail as the rest of your spine, this is a full stretch on the neural system, which if you've got a healthy neural system and no problems with your low back is probably fine, but if you've got low back pain with forward bends, it is a little bit loaded, so best avoided for the short term. So to summarise, if you've recently injured your lower back and are experiencing pain with forward bending, it may actually be best to avoid some of those postures in the short term. For management of simple aches and pains with forward bending, the key is to prepare well with hip and hamstring stretches. I like passive unloaded stretches such as supine with straps. During standing and seated forward bends, ensure you have a small anterior or forward tilt of the pelvis, which is a bit like sticking your tail out or letting a little bit of water tip out of the front of your pelvic bucket prior to bending. Allow your buttocks to relax and your sitting bones to widen, which will encourage a good movement pattern with the axis of rotation at the hips and a fold at the hip crease. Bend your knees a little if you need to. Utilise equipment such as bolsters or straps, and remember that some of the double leg forward folds can be more challenging. Thanks very much for joining me, and I hope the information that I've provided has helped you find ways of modifying your yoga practice to help you with your recovery.